This is a teratoma, a rare tumor that grows teeth, hair, and even eyes, and it lit this woman's brain on fire. In 2009, a 24-year-old journalist named Susanna Cahalan woke up in a hospital room with no memory of the past month. She had a restraint mark on her wrist. She had been tied to the bed. The doctors told her she had been psychotic, violent, delusional, that she had screamed at nurses, tried to pull out her IV lines, accused her father of being an imposter. None of it felt real to her, because she had no memory of any of it. She was a healthy young woman. No history of mental illness, no drug use, no obvious reason for any of this. Doctors had spent weeks telling her family she was having a psychiatric breakdown, schizophrenia, bipolar disorder, alcohol withdrawal, even though she barely drank. One doctor told her parents she just needed rest and psychiatric medication. He was wrong. Something else entirely was happening inside her brain. And if one doctor had not asked the right question at the right moment, she would have spent the rest of her life in a psychiatric institution, or she would have died. It started small, the way these things always do. In January 2009, Susanna noticed what she thought were bug bites on her arm. She became convinced her apartment was infested. She called her landlord. He found nothing. She called again. He found nothing. She called a third time. This is important, not because of the bugs, there were no bugs, but because of what it tells us about what was already happening in her brain without her knowing it. The paranoia came first, weeks before anything else. Then came the seizures. One night she woke up shaking, her body moving without her permission. Gone in seconds. She told herself it was nothing. Over the next few weeks, Susanna changed. Her colleagues noticed it first. She became erratic at work. Her memory failed her. She cried without knowing why. She laughed at the wrong moments. Her boyfriend watched someone he did not recognize move into the body of the woman he loved. By February, she was in the hospital for the first time. Doctors ran tests. MRI, normal. Blood work, mostly normal. EEG, slightly abnormal, but nothing alarming. She was sent home with a diagnosis of stress and possible alcohol abuse. She got worse. Within days, she was seeing things that were not there. She became convinced her stepmother was evil. She heard voices. She stopped sleeping. She stopped eating. She was admitted again. This time, she did not leave. For the next several weeks, Susanna Cahalan was held in the epilepsy ward of a New York hospital, watched by cameras 24 hours a day, sedated when she became violent, restrained when she pulled at her tubes. Multiple psychiatrists evaluated her. Multiple diagnoses were considered: schizophrenia, bipolar disorder with psychosis, schizoaffective disorder, drug-induced psychosis. No one knew what was wrong with her. Her family was told to consider long-term psychiatric care. Here is what was actually happening inside her brain. Her immune system, the system designed to protect her, had turned against her. Specifically, it had begun producing antibodies that were attacking her NMDA receptors. NMDA receptors are the communication system between your neurons. They control memory formation, regulate behavior, and play a fundamental role in consciousness itself. When they stop working, when they are actively being destroyed, the brain goes haywire. The person experiencing it cannot tell reality from hallucination, cannot form new memories, cannot regulate their emotions or movements. Their personality disintegrates. From the outside, it looks exactly like severe psychiatric illness. From the inside, in the rare moments of clarity Susanna later described, it felt like being trapped, like watching yourself from underwater, unable to reach the surface. Now, why was her immune system attacking her own brain? Somewhere in her body, she did not know it existed, had no symptoms related to it, had no reason to suspect it. There was a teratoma. A teratoma is a type of tumor, usually benign, that grows most commonly on the ovaries. They are germ cell tumors. meaning they grow from cells that have the potential to become any kind of tissue. Teratomas have been found containing hair follicles, teeth, and muscle tissue. They are, in the most literal sense, a body growing inside a body. The leading theory for what happened to Susanna is this. The teratoma contained neural tissue, brain-like tissue. Her immune system found this tissue, recognized it as foreign because it was foreign, growing in the wrong place, and attacked it. But in attacking the teratoma's neural tissue, the antibodies her immune system produced also attacked her actual brain, specifically her NMDA receptors. Her own immune system doing its job, destroying her mind. Susanna had been in the hospital for almost a month when a doctor named Suhail Najjar was called in as a consultant. He became the last chance. He sat with her. He watched her. He asked her to draw a clock. She drew a circle. She drew the numbers. All of them, 1 through 12, crammed into the right half of the clock face. The left side was completely empty. Dr. Najjar looked at that drawing and understood immediately what nobody else had seen in a month of tests and consultations. The left side of her brain was not functioning. He told her father, "Her brain is on fire." Within days, Susanna was tested for anti-NMDA receptor encephalitis, a condition so recently described that many of the doctors treating her had never heard of it. The test came back positive. The teratoma was found. It was removed. She was treated with immunotherapy, intravenous immunoglobulin and steroids to suppress the immune attack on her brain. Slowly, over weeks, Susanna Cahalan came back. She spent months relearning things she had lost. How to walk properly, how to form memories, how to be herself again. She went back to work. She wrote a book about what happened to her, Brain on Fire, which became a New York Times bestseller and was later adapted into a film. And then she did something that might be her most important contribution. She investigated how many people like her might be sitting in psychiatric wards right now. She found research suggesting that a significant percentage of people diagnosed with schizophrenia, some estimates suggest up to 6%, may actually have undiagnosed autoimmune encephalitis. Treatable autoimmune encephalitis. Anti-NMDA receptor encephalitis was only formally identified in 2007, 2 years before Susanna got sick. Before 2007, it had no name. Anyone who had it before 2007 was almost certainly diagnosed with psychiatric illness and treated accordingly, with antipsychotics that did nothing, in institutions that could not help them. Susanna Cahalan survived because one doctor asked her to draw a clock, one specific test, one moment of clinical intuition. One doctor who had read about a condition most of his colleagues had never heard of. Everyone before him had looked at a young woman screaming and crying and hallucinating and seen psychiatric illness. He looked at the same woman and asked, "What if this is not psychiatric? What if this is the brain itself being attacked?" That question, what if we are wrong about what this is, saved her life.